Hello, this is Stephanie Joseph with Indiana State University, Nursing 444, Community Health Nursing, with a Clinical Health Education Project number 2, Asthma. This project and this educational video will go over some of the basic information about asthma. Let's get started. Asthma pretest. We're going to go over this pretest, a small, simple pretest, just to get a baseline understanding of your knowledge of asthma. I'm sure many of us have experienced, known, or came in encounter with someone who has been affected by asthma. 3 simple questions. What is asthma? Who does asthma affect? And how is asthma treated? These 3 questions, if you've gotten them right, then you pretty much have a basic understanding of asthma. But let's dive in a little further to see if we can expand that knowledge. This presentation will help learners define what asthma is. They will be able to describe how asthma is developed. The learner will be able to explain how asthma affects children, as well as how to explain how asthma affects adults. The learner will be able to describe triggers of asthma and define and describe an asthma attack. The learner will be able to describe the treatment of asthma. Let's take a look at what exactly asthma is. Asthma is defined as a condition in which a person's airway can become inflamed, narrow, swell, and or produce extra mucus, which is what makes it difficult for them to breathe. As you can see in the diagram on this slide, how a normal airway would look versus an asthmatic airway. And then once again, during an asthmatic attack, it's even more constricted. So let's take a look at who's affected by asthma. In America, asthma affects roughly 25 million people, which averages out to be around 1 in 13 Americans, affecting roughly 8% of adults and 7% of children. Asthma is found to be more common in adult women than in adult men. It is known to be the leading chronic disease noted in children, affecting around 5.1 million children under the age of 18. It is known to be found more common in boys than in girls. As you can see from the diagram in 2019, those numbers of percentages for adults and children, male and female, as well as the African American community being the highest number of percentage who is affected. Types of asthma and common symptoms. There are various different types of asthma. Some of the types are listed here. Adult onset asthma, exercise-induced asthma, occupational asthma, asthma COPD, non-allergic asthma, allergic asthma, and pediatric asthma. Some common symptoms that are noticed with asthmatics are coughing, shortness of breath, wheezing, and chest tightness. People with asthma may experience a medical emergency. It is important to know the signs of a severe asthma episode, or what we call it, an asthma attack. If you notice that a person is having those chest pains and wheezing, shortness of breath, more than likely it is an asthma attack. How is asthma diagnosed? Let's explore the different ways that asthma is diagnosed. There are various ways that a doctor may use for testing and diagnosis of asthma. Some of those ways may be by taking a detailed medical history, performing a physical exam, having a lung function test done, and ordering a chest or sinus x-ray. With these results, the doctor would review and go over each result to determine what type of diagnosis of asthma one may have. Symptoms and triggers. There are many different symptoms and triggers for asthma. Some of the symptoms could be shortness of breath, chest tightness or pain, wheezing when exhaling, which is a common sign of asthma in children, trouble sleeping caused by shortness of breath, coughing or wheezing attacks that are worsened by a respiratory virus such as a cold or the flu. Symptoms can appear when you are exposed to certain triggers. A trigger is something that you are sensitive to that makes your airways become inflamed. This could cause swelling, mucus production, narrowing in the airways, and things of that nature. Some of the most common asthma triggers are pollen, chemicals, extreme weather changes, smoke, dust mites, stress, and exercise. Now let's look at prevention of asthma attacks. The best way to prevent an asthma episode or attack is to follow your treatment plan, learn your triggers, and avoid them. Take your allergy and asthma medication when you should. Use your quick-acting medicine as soon as you start to notice symptoms. Many people live normal lives with asthma if it's properly managed. With a good treatment plan and guidance from your doctor, you can still do much of what you enjoy. For example, many professional athletes have asthma. More Americans than ever before have asthma. About 25 million people in the U.S. have asthma. It is one of the most common and costly diseases. Treatment of asthma. People with asthma usually see a doctor that specializes in things such as allergies and the immune system. You and your doctor will produce a treatment plan to treat your specific type of asthma. It involves, usually, a blend of medications and how to avoid triggers. Some medications, such as long-term asthma control medications, are generally taken on a daily basis and are cornerstones of the asthma treatment. These medications keep asthma under control on a day-to-day basis and make it less likely that you'll have an asthma attack. There are also quick relief asthma rescue medication, which are used for rapid, short-term relief of symptoms during an asthma attack. They may also be used before exercise or when your doctor recommends. Allergy medication also may help if your asthma is triggered or worsened by allergies. All right, now you have gained some newfound knowledge about the topic of asthma. I'm sure each and every one of us know or have experienced someone with asthma. And with this basic knowledge, you'll be able to have a better understanding on the topic itself. So let's test that knowledge with a simple post test. 3 simple questions that if you just remember the things that went over in this presentation, you will surely get them right. 1. What is asthma? 2. Who does asthma affect? 3. How is asthma treated? This completes the Community Health Education Project 2, Asthma. I hope the newfound knowledge that you have gained from these slides serves you and your community well. On this slide, there are a few references and websites that you can visit if you have any additional questions.